Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning, Megan Culp. It is Thursday, May 21st.
May 21st.
Yeah.
Graduation day for Farmington High School.
That it is. Mm-hmm. Congrats. Go Scorps.
Go Scorps.
See, there you go. And we have to give a shout out then to PV that graduated on Tuesday. Yep. Rocinante graduated last night. So there you go. There's Farmington. So congrats. And congrats to all the seniors. I think we need to know, now that you've opened that door, we should say congratulations to every senior within the sound of our voice.
That's right. That's right. We should have printed out a list.
Go forth and do great things.
Commence.
Yes. Perfect. We are here for our COVID-19 local information program, everybody. And so today we have a bunch of things scheduled.
Yeah.
Excited about that. We're talking with two local doctors from San Juan Regional Medical Center about some of the new news we keep hearing about COVID-19.
New news.
And I know that's confusing maybe for folks because what you thought was the best practice last week is maybe different this week.
Yeah.
So we're going to do that. We're going to talk to a survivor of COVID-19, local guy who is doing well, which we're glad about. And then a special surprise at the end of the show about and I called him a newly minted high school graduate.
Okay.
Yeah. So
because he just graduated.
Yeah. And now he's already doing community stuff.
How great is that?
It's cool. So he's going to share
Good
that
job,
with
Sean.
us. So yeah, thanks for spilling the beans. It's okay.
This is like
good job, Sean.
You think we were bringing on a celebrity?
We might.
It's true.
You don't know.
Stay tuned.
You don't know. The Zoom is a powerful thing.
It is.
Yeah. So anyway, but this is the day we get to share some numbers that the county compiles about our cases. And I know every day we share like the daily numbers that we get from the state health department, but the county is sharing kind of those 7-day average numbers, which kind of takes out some of the big peaks and valleys of the daily numbers. And so those are really interesting to take a look at. And so I want to share those on the screen right now, everybody.
Promising today.
Yeah, as we take a look, even my previous guest, Mike Stark, who was on the 8 o'clock show, was excited about this number. So this is 7-day averages, right? And it's showing numbers from San Juan County, the Navajo Nation, and the state of New Mexico, COVID-19 cases, right? So you take 7 days, you average those numbers, and you make them into a graph, and this is what the number looks like. And take a look at that curve.
Man, well, it's plummeted.
Yeah, which is good.
Downright plummeted.
What we want.
That's exactly what we want. Usually you don't want plummets.
We want plummets in this case.
But we want plummets in this case.
Indeed. And so I think the hope is we see maybe 1 week of plummet. And if we can get 2 weeks of plummets in a row, that would really maybe set the stage and make the case for reopening more of San Juan County, and hopefully the governor's folks will
catch up with the other
agree
folks.
with us.
Yeah.
So anyway, so we think that's positive. And again, we're pulling this from the San Juan County website, sjcounty.net. If you want to take these numbers, take a look at these graphs for yourself, but that's where we're finding these things. And again, these are 7-day averages with the COVID-19 cases. And again, just to point out, there's only 3 lines on this graph. There are 4 things in the on the chart, but one of those is no longer being reported. And that's why it's not there anymore. So it is the
Navajo Nation San Juan County cases are not on the graph.
Right, because they're no longer breaking those out from the Navajo Nation. So that's why they're missing, everyone. Just want everyone to realize that. And then there's one more graph that we want to show. And so if I forward through here briefly, everybody. So again, these are the 7-day averages for new cases in San Juan County, and then the COVID-19 deaths in San Juan County. So these are really local numbers as well that we want to share with everybody. And you can again see the plummet, which we like.
Big plummet.
7-day averages. So
that's right. Of 204 cases. Right?
It was 304, and now it's 100.
Yeah.
Right. 304 to 100. That's where we are on average. So. We hope we keep seeing that trend continue.
Significant.
So keep on doing what we're doing, everybody. I think that's the other words of advice and what our doctors will tell us here, too, in just a few moments about social distancing, physical distancing, wearing your masks, washing your hands, not touching your face.
Stay the course.
All those things are making a difference. And that's what you can see. And there you go. So
Now we have figures to prove it. It's
We
making
do.
a difference.
And again, and when we hear from the governor and her cabinet secretaries about the decision-making process that they have about whether or not to amend some of these public health orders for San Juan County, these are the types of numbers that they're looking at to make those decisions.
Right.
And so we're grateful for them, and we hope that they will take a good hard look at these numbers, and they'll continue to show us kind of lowering that curve and doing well. So there you go.
Cool. Hey,
Yeah.
that's positive news.
It is positive news,
Yes.
and we're glad to share that with everybody. So these numbers are updated. Again, these graphs are updated by the county on Wednesdays, which is why we share them on Thursday's show. They're not ready for our Wednesday show,
Right.
so that's why.
Right.
There you go. All right. Should we hear from the doctors?
Yeah, let's do it.
This is Brad Greenberg and Aaron Philpott from San Juan Regional Medical Center, and we'll hear what they have to say this week. Joining us now to talk a little bit about the local conditions here as we talk about COVID-19, the coronavirus. Again, our guests from San Juan Regional Medical Center, Dr. Brad Greenberg and Dr. Aaron Philpott. Good morning, both of you.
Good morning.
Good morning.
Thank you for being with us. And as usual, we have lots of questions for you. We've been saving them up since the last time we talked.
true.
So, Megan, I know you have a lot of questions.
I do
about
always.
everything,
Too. Yeah, exactly.
including things for our guests.
Yes, exactly. So hydroxychloroquine has made it back into the news these past couple of days. And so can you guys give us an update on the status of that?
Yeah, I'd be happy to do that. There's still not a lot of great data or really good studies demonstrating that it is effective in reducing the severity of COVID-19 or increasing ICU length of stay or intubations, et cetera. There's a little bit more data coming out that is demonstrating that it can have some adverse effects, the main one being cardiotoxic, meaning it can affect the heart in a way that changes some intervals that puts people at risk of having abnormal or dangerous rhythms. So we're definitely using it very judiciously for appropriate patients while monitoring very closely if we do use it in patients.
Great. And then switching gears to a more nerdy topic, and Dr. Greenberg said he can maybe speak on this a little bit, about using CRISPR, this gene editing technology, as a form of treatment.
So there has been, in recent years, a lot of excitement about using sort of a recombinant DNA technology like the CRISPR tool in a range of different therapies. Gene therapy has actually been a really exciting potential medical therapy for decades now, but it still remains really challenging to try to figure out how it actually would figure into the range of therapies available for lots of different diseases within medicine. I think it's exciting that they're considering a novel treatment approach for coronavirus using that tool, but we're not doing that kind of research at our facility, and I'm definitely not really aware of where that would sit right now. I think it's an interesting technique for use in medical therapeutics, but still needs lots and lots of study. But as you can see, we're doing our best across the country and the globe to essentially throw the entire toolbox of things that exist within medical therapeutics to try to address meaningful therapies and cures for COVID-19.
Thank you very much. And another question for both of you would be, we're hearing a lot about masks. There is now a new order in our state to wear masks when we're out in public. And I think you've explained this before, and I think maybe some folks have a hard time understanding how masks can not necessarily protect us from catching COVID-19, but it really protects others in case we are asymptomatic and maybe unknowingly spreading this to others that we might come in contact, whether we're out shopping or what have you. But can you just maybe run through some of those ideas of how these masks work in that regard? And then also I want to ask you a bit about maybe folks that maybe say they have respiratory problems and find it uncomfortable or even dangerous for them to personally wear a mask. Who would like to take that one?
I'll start with some of the science behind it because I think that's really important to understand for people. and to really think about a mask and our fellow friends, colleagues, or strangers within our community, and how we can help and protect each other, especially our more vulnerable residents. So there's more and more data out there that's demonstrating people probably shedding the virus when they don't have symptoms or are pre-symptomatic, meaning they're going to develop some symptoms but haven't yet. So, like flu, often the highest levels of viral shedding is early in the course of the illness, so when people are actually sick. So we get a good clue, and then we're not feeling well, so we subsequently stay home. With coronavirus, that's seeming to be less the case. People are shedding probably high levels of virus. One study found, actually several studies have found that you may be shedding up to 5 days prior to onset of symptoms. One showed that peak shedding occurs about within the day before developing symptoms. So that's, in theory, when you're most transmissible. So you're spreading the virus before you even get a clue that you are sick with the virus. So you can imagine the huge impact that could have on transmission, because people are out shopping at Walmart, or they're going to the grocery store, carrying on in their day-to-day without knowing that they're contagious. So I think the mask, as we've talked about before, are really, we found it most effective to contain your respiratory droplets. And just to remind everyone, the main mode of transmission is through large respiratory droplets. So when someone is talking loudly or just talking at all, coughing, sneezing can project droplets. So that's what those droplets from transmitting the virus to others.
Thank you. I'm just going to say, and that's why Megan sits on the opposite end of the studio when she's talking loudly.
Perfect.
Thank you. And I know, and that's the whole thing, though, right, Dr. Philpott, is with these, with the masks. I've seen a lot of well-meaning Facebook friends. Believe me, I understand. And they'll post a meme or something that says the virus is only this size, and so the mask is this size, and obviously the virus is going to get through the fabric. So what's the problem? But it's the droplets, right? And that's what the virus is attached to, and that's what's going to stop the transmission, right? Because that gets blocked by your mask.
That's exactly right. Yeah, there's probably some aerosol transmission, which we've talked about before, and we see more in the hospital with sick people on various procedures. But really the biggest mode, the most well-known mode, much like flu, is the droplets, as you said. So the mask is very helpful for that.
Is there an update on how long the virus stays on surfaces?
Brad, do you have
Not
any
aware
updates on that?
Not really an update. I mean, I think that there's still some concern that it may live on surfaces for somewhere between 2 and 9 days with normal ambient temperatures, and sometimes longer. Now, it all sort of depends on exactly how they're testing for it. There's a question of, can you detect the presence of the virus on a surface for that long? Or the other question is, does the presence of the virus on that surface indicate that it's like a live transmissible virus? Those are sort of two separate but related questions. But I think the key is that it can live on surfaces for a period of time which is much longer than we're all comfortable with. It's not 5 minutes, it's not 10 minutes, it's probably in the days long. And so it remains important to keep surfaces clean, to frequently wipe down high-touch surfaces and high-touch areas, and to be cognizant that fomite transmission, which is the transmission of a virus from like an inanimate object of some kind, can occur. That's one other thing, too, about masks that's real important, is that not only does it prevent you from inhaling these things, but it's also a reminder for you not to touch your face, not to touch your nose or your mouth. And that also can minimize the transmission from a fomite or an inanimate object to the body through your hand. So I think that's also another important piece there when we start talking about how long it could live on surfaces.
Right, but those times are shocking to both of us,
2 to 9.
to
We were
say
like,
the
oh
least.
my God,
but
we're
yeah,
screwed.
both of us kind of our jaws dropped. But let me ask you both again about with masks and talking about, for folks who maybe have respiratory problems and things like that find it difficult to wear a mask. Is there any advice you have for them or obviously, that we want to keep people comfortable and being able to function. But if you have a hard time breathing even without a mask, how can you be safe with a mask?
Yeah, a few more comments on that, and thanks for bringing that up again to complete that out. People who have breathing or respiratory issues who are on oxygen, they're our most vulnerable people or patients, and I think it's on the rest of us to really help protect them from us. So I think there will be some people who are not able to safely wear a mask for the reasons you've outlined. And that's why I think for the people who can safely do it, who don't have respiratory issues or, severe mental health issues with PTSD or claustrophobia or different issues like that, then we really should, if we can, wear a mask to help protect those other people and reduce transmission. There's also correct ways to wear a mask, which I've seen various methods out there, some way more effective than others, which are quite frankly ineffective if not done right. And that's, you have to have, the mask needs to fit well, and it needs to cover your nose and your mouth. And people not in the medical field, I think, have a hard time just not touching it, leaving it on, talking with it on, doing everything they possibly can with it on, without messing with it. And that's very important because, as Brad was just mentioning with the fomite transmission, you could actually put yourself in a more difficult or a more dangerous situation if you're touching things and then touching your mask, getting viral particles on your mask, and because you're messing with it more. So a mask really needs to be well-fitting, cover your nose and mouth, and not be frequently touched and not be removed when you talk or do anything. It should remain in place when you go out in public.
Thank you.
One other comment about that also is that there's some discussion now, at least in the media, about the use of the Americans with Disabilities Act as an exemption associated with masks. And one thing that's important is that if folks do have difficulty wearing masks, it's important that they also make really good choices as well. Because the American for Disabilities Act, it usually requires some accommodations that would limit access to individuals with a disability. But the ADA does allow for restrictions when that individual could pose a direct threat to the health and safety of others. And so it's not a clear black and white issue when it comes to the use of the ADA. It's not a blanket, I can do what I would like or not wear a mask. Because what we're talking about is that, the ADA and the equal opportunity, I think that there's the EEOC declared that the COVID-19 pandemic meets the direct threat standard based on guidance from the CDC. And so I think that we need to really stay on top of this. But right now, I think that it is strongly encouraged for, if at all possible, wear a mask when out in public to protect yourself and to protect your neighbors and other members of the community. And that, politics aside, we're really just talking about science and safety. And please make really good choices about how to protect yourself and how to protect others.
Well, Dr. Greenberg, I can't thank you enough for mentioning that. And coming from you, that means a lot more than just coming from a Facebook meme or coming from me. But it sounds like maybe you and I have the same Facebook friends, because I've seen some of those things, and I can't just print off that certificate from Facebook that says, according to the ADA, I don't have to wear a mask in your store. But I appreciate that.
I looked into that. And I looked into that, and those things there's no endorsement from the ADA for use of any certificate, even if it appears official or not. And I think that, unfortunately, we're in a gray area, and people want to be able to say, I can do this because either I want to, and produce certificates that they may have pulled off the internet. But, this whole pandemic is challenging and difficult, and it's gone on for for a long time, longer than any of us would like it to go on. But this is the situation that we find ourselves as individuals and as members of a larger community. And it's hard in our collective memory. It's hard to think of a time when it was quite like this. But if we look at history, there are many times in the past where we've had challenges like this that require us to make sacrifices and require for us to take a slightly different look at things that we, in months or years past, kind of took for granted. And so I think now it's somewhat sobering to have the realization that we find ourselves collectively in a new and uncharted territory with COVID-19, in a new age with a lot more technology and a lot more medical advancements and a lot more information technology and rapid communication. But boy, we are where we are, and there's no sense in denying the science behind it, and there's no sense in denying the important, relatively simple precautions that need to be taken in order to safeguard the health of ourselves, our loved ones, and the community at large. So, and as we figure out the ways to improve and to make easier all of these processes, we'll continue to do so. But for the time being, we need to remain steadfast with the social distancing, with the mask policy, and with what will probably be an emerging new field of case investigation and contact tracing, which will also help us get out of this pandemic the way that it is today.
Great. And speaking of gray areas, it seems that there is a constantly evolving understanding, but also that we hear stories about is the virus itself evolving quickly. So maybe, Dr. Philpott, maybe you can speak to that. Is it a yes and are understandings evolving? Also, maybe the virus is evolving. Is the virus getting more virulent? Can you speak to some of that?
Yeah, I just have a couple comments. I don't know a lot of details about the latest sort of viral sequencing and how things are looking different. I know initially thought to be two main strains. I think the one major thing to think about with that, as you mentioned, we get into a situation where the virus does change and is more virulent, more similar to the SARS-CoV-1 or the SARS virus of 2002, 2003. And then the second question is it changing fast enough that people can be reinfected with it? And I think that is still the question out there. They initially thought there were some cases in South Korea, and it's been a little bit of a moving target, but they've wondered about, has it changed enough to reinfect people, or is it the same virus that's reactivating? So I think ultimately the last I had read is it was actually thought just to be a very prolonged illness of the same original illness. There was, I believe it's the USS Roosevelt out of, I believe, Guam, that had multiple sailors infected, and then 5 of them had recently developed symptoms once again and tested positive after testing negative. 3 of the 4 most common coronaviruses, so the ones that we've talked about before that cause the common cold, that are well known or we're all, our bodies are aware of, you can get reinfected with those. So they change enough each season that you don't develop memory antibodies or immune cells to fight off the virus, or they don't remember it perfectly to neutralize it. So I think those are some of the things we think about that are very similar to flu in that regard. There's a lot of things that are very distinctive from flu with SARS-CoV-2 or coronavirus, but in that regard, it may be something similar where you get shift and then drift, and it's just a matter of if you're dramatically changing the virus or just slightly changing the virus. Do you have any more on that, Brad?
No, I think that there's just a disagreement right now about does it mutate, does it not mutate? Do we have dominant strains? Do we have only one strain? And it just, led to lots of questions about, we all read about cases which either re-emerge or represent re-emergence, latent infection, or reinfection. And we don't know the answer about exactly what that means. And so there's lots more research that needs to go to describe what the natural course of illness is, and then even more what the natural course of the illness is across populations. And people will not necessarily respond to the virus in the same way. So I think that we'll learn more about the virus, and we'll probably have lots more answers in 6 months or a year about what to expect and what the implications are, because all these things have direct implications for vaccine development, for therapy development, and for understanding how to take care of these folks in different kinds of clinical settings too, in clinics and hospitals, emergency departments, et cetera. So lots more developing. But again, no great hard and firm answers until the science is worked out.
Very good. Well, we appreciate both of you joining us again this week to answer our questions and to give us an update. Again, it seems like this is a constantly evolving topic as we learn more about this. And so it's always great to be able to talk to both of you to set us straight on the latest that you're hearing in your lines of work. So thank you both very much.
Thank you.
You are welcome. Thank you so much. That is Dr. Brad Greenberg, Dr. Aaron Philpott from Salmon Regional Medical Center, our guests here on KSJE.
Yes. Our faves.
Yes. And we're back here in the studio. Great interview. Again, we
love
appreciate
it.
the local information. That's what we're talking about here. So it's all local all the time.
All local,
KSJE.
all the time.
That's
KSJE.
right. So now we want to go to our next guest.
That's right.
On the show today. And he is a survivor of COVID-19. We're very happy to have on the program Emmett Fowler through the miracle of Zoom. And Emmett, welcome. It's good to see you and see that you're doing well. Welcome.
That's good. It's good to be here. Literally, it's
No
good
kidding.
to be here.
Right?
And the ability to inhale and exhale. And I tell you what. And thanks for letting me be on with you. I've actually had an opportunity to do a couple of interviews already. So.
I'm sure that's very true. So talk to me a little bit about your case. And of course, you were in the hospital, but you're out of the hospital. And so when did you find out that you were sick, that you were COVID positive?
It was back in March, right about spring break.
So really early on in the kind of the shutdown, right?
Yeah, it was right at school, because I've been teaching, so and we were getting ready to get the kids out, and but it was about that Tuesday or Wednesday of spring break, and what happened was I basically just got that fever. Man, that fever, it's brutal. It's insidious. That's the word I've been using, insidious. It's like none other fever that you will deal with, and my wife, unfortunately, she picked it up too. The problem with the early on was we were not able to get a test, because the testing protocols required fever with shortness of breath, coughing, and really all we had was the fever.
Okay. And so so you were just kind of in the hospital with some of these symptoms then, but didn't really know that it was coronavirus? Is that the idea then?
Well, actually what happened was I went in and they said, we can't give you a test. But unofficially, they said it's most likely. They couldn't tell me that you might have it. But all they could do was send us home. They sent me home. They told me, hey, just fluids, lots of Tylenol, just get a lot of rest. And that's basically what I did for 14 days. I had the fever for 14 days. It was after what happened, after I fought the fever. And this is the way a doctor explained it to me, and this is how insidious this virus is. Is that because your body has been fighting something it has nothing to fight it with, right? There's no antibody. You don't have anything in your body, an immunity against this virus. It compromises your immunity, and what happened was I got a really serious sinus infection, but then pneumonia set in. And so the pneumonia got me, and what happened was I had a pneumothorax, which is a collapsed lung because of pneumonia.
Related to this initial infection, right?
Yeah.
Wow.
Yeah.
And so we've got a photo of you, Emmett, in the hospital, right? Or standing next to your hospital bed that I want to show everybody.
That was my last day. That was when I was leaving.
So
I don't know.
Yeah.
I'm watching, so if you throw
it's going to be up there in a few minutes, probably, if you're watching. There's a little delay. Thank you, Internet. But so you were sent home originally, but then you eventually did have to get admitted to the hospital, obviously with a collapsed lung, right?
Yeah, I went in on Easter Sunday. Yeah, Easter Sunday
Wow.
morning.
Great resurrection.
Yeah.
Right. Oh, by the way, hi, Megan.
Hi, Emma.
I went in thinking, oh, they're going to treat me for pneumonia, probably get an inhaler, and they said you got to stay, you got a collapsed lung, and they immediately, I was in the ER. They within minutes, I had a tube in my under my right arm in my ribs, and there was just stuff drained. Without going into a lot of detail,
Yeah.
and
Thanks.
that was my admittance, and I was there for 12 days.
12 more days. Wow.
Yeah, they ended up having to put another tube in me.
Oh my.
But that's how the virus can get you. You may not have the cough, anything, but I thought I was getting better. In fact, I was feeling better, and I thought, okay, I'm going to get past this until, pneumonia set in, and they said it was novel coronavirus related.
Wow. And so, just for folks that are listening and watching this morning, Emmett Fowler, you would say that you were infected with this, and it impacted your health for probably what, more than a month?
Yeah, probably about 6 weeks, and they did finally test me when I was in, and I was positive.
Got you.
Positive with the virus.
Okay.
But
And so, and again, we know that, or at least from the other cases, right, this impacts everybody differently. Not everyone has severe symptoms, but people like you may have some symptoms and then have other complications, right?
Absolutely. In fact, like, again, my wife, she was taking care of me. Well, she got sick.
Yeah.
But she dealt with it for about 4 days, and she started feeling fine, and she hasn't had a problem. We got her tested recently. She was negative.
Well, that's good.
Yeah. So, and I recently was cleared by the state health department saying that I don't have to be quarantined anymore. So.
Well, that's good.
I don't. But honestly, something within me says, you know what? I mean, I was listening to the interviews with the doctors, which, by the way, I'm going to plug. We have a great hospital here, San Juan Regional Medical Center. We have an amazing hospital, and tell you what, the nurses and the docs there, they're working hard, and I think I feel that in there because if people would understand what the impact would be if we didn't do what we're supposed to do, like they're saying, wear a mask, social distance. I mean, I can tell you, every nurse that took care of me, they have this kind of fear going, you know what, this could be a horrible thing where we will have no room for people. We will. I mean, as good as our hospital is, we have to do. And I'm plugging what they're saying, but we have a great hospital.
Mm-hmm. Well, we don't want to overwhelm our hospital, too. That's the whole point of all this, right? And so I guess in our minutes remaining here, Emmett Fowler, and when you, I know you're on social media and I'm on social media, and we have several of the same friends on social media, but when you see these posts about, I'm not going to wear a mask, or I'm going to go, if a store requires me to wear a mask, I'm going to go somewhere else to a store that doesn't require me to wear a mask. I mean, as someone that's lived this and walked the walk and talked the talk, I mean, can you give us your impressions of seeing folks like that really feel this is an infringement on their God-given right to infect other people?
Yeah.
For lack of a better term.
God-given right to infect other people.
Yeah. I'm a believer. I mean, we all see things through the filter that we live through. I'm biased because I lived through the filter of laying in a hospital bed, not knowing if I was going to live or die. Literally. I mean, I went through some deep emotional moments. My wife and I, we cried on Facebook together, not knowing what was going to happen. So that being said, people are living through the filter of, well, my business is closed. People are living with, I'm an American, that filter. But that being said, this has nothing to do with, and again, this is my opinion. I wear a mask even though I'm COVID-free, apparently, because I respect the other person next to me. They don't know that I was in the hospital. They don't know I was COVID positive. But I'm going to wear a mask out of respect to them, so they can get out and function. And if they're wearing a mask, hey, we're doing what we need to do to keep this virus down. So I'm biased. I think we got to do now. As far as the economy, businesses, we need to find a way to get open. But to me, the paradigm shift is we just got to figure out how to do things, and we're going to have to do things differently for a while. And I'm, in my mind, this is temporary. But I'm pro-mask. If you're not wearing a mask, I mean, what are we going to do? But at the same time, it's like we can all be carrying a gun, and somebody's got their gun on safety, and somebody doesn't. Something could go wrong. See what I'm saying?
I do. Yeah.
I don't know if that's a good analogy or not. Yeah.
It's a powerful one.
It definitely is
Yeah.
a powerful one. Well,
Yeah.
Emmett, I mean, we're so thrilled that you're feeling better and that you and your wife are better and you're on the mend. And we're getting a lot of Facebook comments from folks who are happy to see that you're on the mend. And thank you for sharing your story with us. I know you've been sharing it with others, as you've said, but it's kind of great to put a face with this. And we hear a lot of stories of folks whose outcomes aren't as well as yours has been. And so we're so extremely grateful that you're here today to tell us how you're doing. So thank you.
Well, thanks for the privilege, and everybody's experience with this is going to be different, but I'm blessed. I'll just put it that way to be here. And again, my perspective has changed. I just breathe in air, and I'm thankful for that.
Wow.
That's what it
Yeah.
takes sometimes. But thank you again for sharing, and you look great. So keep up the good work.
I lost 20 pounds.
Wow.
Wow.
Yeah.
I'm sure you don't recommend that diet, though.
No, that's not
Not
a good
at all.
diet.
No. There you go. All right, Emmett. Stay well. And to you and
Thank
your
you.
wife, stay well. Thank you very much. Emmett Fowler, survivor of COVID-19, our guest, right?
Wow. Yeah. Well,
6 weeks. Can you imagine?
No,
6
I can't.
weeks.
And I can't imagine a fever for 14 days.
No. Right?
Right? I mean,
I can't imagine.
that's just some nasty. It's really, really helpful to hear his story, too, because Emmett I don't think he would be considered the high-risk population that we hear about.
That's right.
Like, he's a younger guy. He was healthy.
Yeah, active.
Active. And so to have a young guy who's healthy and active suffer like that I hope that wakes people up to the severity of it, if you haven't already been woken up to the severity of it.
Right. Exactly. So I agree.
Yeah.
But
Woo,
there you
harrowing
go.
experience.
No kidding.
For
But
sure.
We're glad that, again, he's on the mend and doing well.
Yeah. He's
And
back to fishing, which is like his first love, I think.
I know, right?
So-
I knew when I saw him back on the river that he was feeling better.
Yeah.
So
he's been resurrected.
that is a good thing.
Yeah.
Exactly. Well, I want to get to our next guest, too,
Yes.
because we're running a little behind here. What else is new?
What else is new?
Right?
What else is new? Let's see. Well, we already talked about how the detention center now has a few more cases, but they're asymptomatic test positive.
Talked about that on the 8 o'clock show with
Right.
Mike Stark. That's
so
true.
if you want to hear more about that, go back to that show. But
Okay. But which is, so again, we have positive cases at the detention center, but a lot of those inmates are certainly quarantined and asymptomatic.
That's right.
So there's that. So there you go. All right, stand by. We're going to our final guest this morning, the surprise guest who you
That's right.
already announced. So there you go.
We don't know. I mean, okay. There we go.
There, yeah. See, here he's coming. He's getting ready. I'm getting ready to get him on the show here, and this is Sean McNally, right? And welcome to KSJE. It's great to have you on the show, Sean.
Thank you for having me.
You-
My social interaction for the week during coronavirus.
This is it, exactly. Well, we're glad to have you with us. And as I mentioned, you are a recent high school graduate this week, correct? Just this week.
I am. I graduated this Tuesday via virtual graduation from Piedra Vista.
Go Panthers.
Go Panthers.
Panthers.
See, there you go. And so now most high school seniors, I would think, would maybe just, take a break, maybe, lie around the house and, get some, I don't know, tater tots or something and just hang out and play video games. But you have gone to work. You have come up with this other project, right? After maybe taking a day off, maybe?
I have. This is something I've kind of been formulating in my head for a few days while coronavirus has kind of kept me in the house. I don't get out much, so have a lot of time to think. And I know how much the coronavirus has kind of messed with my year, and I can't imagine how hard it must be for healthcare providers. So I am starting a project called the Unity Project that is designed to thank the healthcare providers in San Juan County for all the work they're doing.
So how does that work? How are you giving thanks to these healthcare providers?
So we're doing a few different things. One of the things we're doing is we are raising money for tiny gift bags for each healthcare provider and every single first responder in the area that is a lot, but they do so much work to keep us safe and keep us healthy, and they are on the front lines of this crisis. Another thing that we're going to do is we're going to have volunteers write small handwritten notes, because really that's what some of these healthcare providers need. You know, they're healers by trade, and it can't be easy for them to be witnessing so much death and so much destruction caused by this pandemic. So I think they really need to know at this time that we as a community are here to support them.
Very good. And so, Sean, you have come up with a Facebook group, right? A Facebook page to spread this information, right, for folks, the Unity Project that folks can find on Facebook to learn more about how they can help in all these projects that you've got in mind, right?
Yes. On Facebook, it is the Unity Project, or you can go to www.facebook.com/the Unity Project 505. And
we're showing it on the screen right now. We're showing the page on the screen right now for folks who are watching us, but great. Okay, go ahead.
Yeah, and we're going to try and do a lot more for the community, just to keep the community strong. You know, I've lived in Farmington all my life, and this is a very important place to me, and the people that live here are also very important to me. And I think that, especially during this unprecedented time of a lot of pain and suffering, I think that this is, instead of, you know, being divisive, we need to come together, and we can emerge stronger than ever before.
So I have a question for you, Sean. Obviously, you're starting this amazing community project, and that's going to keep you busy. What were your fall plans before this disaster struck? What were you thinking?
So I am planning on attending the University of New Mexico, a medical program called the BAMD program. And it's designed to create doctors and keep them in the state of New Mexico. Even before this pandemic, we had a severe healthcare shortage. You know, a lot of doctors don't want to work in these rural areas of New Mexico, and that is right now where we're seeing the most suffering and by far the most number of deaths. And so that was supposed to be my plan, and hopefully it's still happening. I know that some things maybe just be changed a little bit, which is probably for the best if we can keep people safe and healthy.
Yeah, and so that was my wondering, because it's very clear to me then that you have a deep passion for healthcare in general and medicine and small towns in need of good medical care. So clearly you're on that's a great first step as you head towards your own medical career.
Yeah, and I'm really just trying to do what's best for the community. My father is a physician's assistant here in Farmington, and he, you know, works at the different nursing homes. And personally, one of the drivers for me to get into this project was I see how hard he's working every single day. And I know that it's not just him working, and there's, you know, countless people behind the scenes and countless people on the front lines trying to keep us as a community safe. And they don't always get the recognition that they deserve. And so I think that now is a good a time as ever to reach out as a community and say thank you to them for what they're doing.
Very true. Well, Sean, we thank you for coming on the program to talk about this project. And again, I know through the Facebook page, folks can contact you and find out how to help. I know you've got a GoFundMe set up to raise some money for some of the things that you want to do, right? For some of these gift things that you want to provide to these frontline workers. And so that's the best way to contact you is through the Facebook page?
That's correct. Yes,
Okay.
You can reach out through the Unity Project Facebook page. If you have me on Facebook, send me a message. Any way you can get in contact, you know, we'd love to really do something great here.
All right. Well, you already are. So, and we're glad that you're sharing with us. So thank you very much.
Thank you.
You're welcome. That is newly minted, as I said, high school senior Sean McNally from Piedra Vista High School, talking with us about the Unity project that he has just launched this week, like yesterday.
Yesterday, yeah,
basically.
right. I'm like, oh, that's what that invite to that page was.
There you go.
I got invited last night. I
See?
joined, so I'm happy that I joined.
There
But
you go.
yeah, and I always think it's interesting to discover people's why are they doing these things, and
Sure.
clearly Sean has a very deep and personal connection to it. So I love
Very
it.
much.
I love it.
Which is great. And again, kudos to him for again just graduating and jumping back into work
At first, I love it.
Exactly. I'm not sure I did that when I was a high school senior.
I did, but
I think I took a week or
understand.
two off, at least.
Did you get yourself some tater tots?
Yes, I probably
Get
did.
yourself
I
some-
think that was a
some
memory.
dreamsicles.
Yes,
Go to the drive-in theater, perhaps.
exactly. Not as motivated as Sean.
No,
that's for
no,
sure.
Not everybody can be as motivated as Sean.
No,
Yeah.
exactly. But anyway, Sean, thank you very much. And here we are at the end of another show.
Great show.
Packed show, right? And we again thank everybody for watching. If you enjoyed the show or had some good information that you want to share, we encourage you to share this show with other people in your social media networks and things like that, because that's why we do it, is to get the word out. And again, it's local information. So
Local information.
that's us.
That's why we're here. We're here for you, Four Corners.
That's right. That's what we do. So thanks, everybody. Have a safe rest of your week. We'll be back on, not Monday. It's a holiday.
Right. We almost forgot it was a holiday because things are so wackadoodle.
I know.
That it's not like you're like, ooh, 3-day weekend, I can't wait. It's like, oh,
Right.
wait, it's a
just-
holiday.
Yeah, just so.
So-
Anyway, but we'll be back on Tuesday
Tuesday.
at 9 a.m. So we'll see you then, everyone. Stay well. Have a good weekend.